So if my argument, right, is that you're more suicidal 7 to 10 years later, and you send me a study
It's
that
not
they're
more
that they're
suicidal. There was
hold on,
no
I'm
increase after
talking,
20
talking,
years. That was the
talking,
standard that
talking,
you
talking,
said.
talking. I feel like Kamala Harris over here. I'm talking. Thank you. Anyway, if I say that suicide increases 7 to 10 years later, and you send me a study that shows that it doesn't increase up to 5 years later, you didn't disprove anything.
You are ignoring the one I just sent you, which was up to 20 years later. And there was no increase in suicide death risk.
From NIH.
Yep, here we go. Let's hear the cope. There's going to be some way that I know there's going to be some way for you to weasel out of this one too. Oh, it was from the 70s, or oh, it was, well, we can't really trust the NIH. All right, I know.
I'll read the study afterwards, but
that's a good idea because it would absolutely demolish your dumb fuck points you've made thus far.
Great. So you don't think there's a social contagion?
That's not what I'm saying is a dumb fuck point. I'm saying you arbitrarily deciding.
Yeah, thank you for coming on. I've actually been watching you recently. You and I are on opposite sides. I want to start with that. But one thing that really impresses me about you is most of the time I feel like when people are on the opposite side, they are reluctant to talk about it. And you are not only not reluctant to talk about it, you want to express your opinion. You go out of your way to find opposition and talk to them and try to actually have debate. And I've noticed that when you have debate, it never divulges into like a screaming match.
You haven't watched all my debates then.
Okay, not all of them, but I don't like screaming matches. I think they're just really unhelpful. I think they make both sides look bad. And I really want to understand where you're coming from with, because I don't understand your point of view at all. Like, I understand how you believe certain things, but I just disagree with it. So starting off with...
so do you think this will turn into a screaming match?
No, because I think that both of us will give each other time to talk, and when you're making your point, I'll shut up, and hopefully you'll do the same for me, and we'll be able to have a good conversation.
Okay, cool. Let me pull up your side of things too. It's Lauren de... Okay,
De Laguna. It was supposed to be like from Laguna, because like if you speak Spanish, de means from.
Okay, cool. Yeah, I'm gonna show this. I like to show the chat of the other person on screen too, because usually it's people that are kind of coping, and it's really funny.
All right. Well, I mean, this is a new channel, so we don't have like a ton of viewers right now, but
okay.
So we're not gonna have the same amount of chats as you're gonna have.
Okay, that's fine.
But I usually do scheduled interviews like a month out. I don't usually do last second stuff like this.
Gotcha.
So my chat is like, what?
Gotcha. Okay, cool. So yeah, why don't we go ahead and talk about some of our disagreements then? We'll see where it goes.
Yeah, I wanted to start off with I heard you say that puberty blockers, although they cause issues like loss of bone density, then the hormones come in, because most children then go on hormones afterwards, and that adds to the bone density, right? So are you saying that like the puberty blockers don't have any negative side effects that aren't going to be recovered by the hormones themselves, like the replacement hormones?
Oh no, I mean, of course there are going to be side effects. The thing is that there is not a single medication that any of us take that's without side effects. The question really is, do the side effects outweigh the benefits, or vice versa? So in the case of puberty blockers, of course there are going to be side effects. There are also side effects when it comes to puberty blockers as well. The question comes down to, though, does it outweigh the benefits, or vice versa? And if we know that there's a decrease in the suicidality of kids with gender dysphoria, if they go on puberty blockers, then I would say that is a positive that outweighs the potential negatives.
I would agree. I think a huge part where you and I would disagree, though, is the studies on the suicidality. From what I've seen, suicidality, especially after transitioning, increases specifically 7 to 10 years after the transition.
Which study was this?
Transgender. There's actually been several. There was one recently in UK. There was one I think it was Israel, but I could be wrong.
Was
But
there one in Sweden that you're talking about? Because that's one that I've heard a lot.
yeah, and a lot of these other countries are not doing these hormone blockers for their children anymore, and they're straying away from this because they're finding that there's so many negative side effects. And then also, there's a large community of people regretting their transition or finding that, maybe they weren't gender dysphoric, they were just experiencing other mental issues such as depression and anxiety, and maybe they were experiencing sexual abuse, so they were conflating their depression, their anxiety with some sexual, discomfort, especially along the times of puberty. And so we're seeing a lot of that, especially with young girls.
I think we should stick to just one thing here for a minute, because I'm more than happy to talk about the social contagion aspect of it. But when you're talking about the suicidality increasing, I would really like to see whatever study you're talking about. The only one that I'm familiar with currently is the Swedish study, which has not only been so heavily debunked at this point, the author herself has come out and said, my study did not demonstrate what people are saying it did. In fact, my study simply indicated that it's important that trans people are receiving the type of care that they need. The author of that study has spoken out.
Do you have that?
Sure.
Quote? Yeah.
Yeah, I can find it. I can show it on my my screen, and also
yeah, and send me a link. But then I would be more than welcome to show you a bunch of studies. A lot of them were discussed on the 4-part series Dysphoric on YouTube about the social contagion. So you do agree that there is a social contagion aspect to this?
I do, but I don't want to get there yet because I want to stick to one thing at a time here. And I have my notes here, but then I always have a hard time because I have so many sources here that it's like, excuse me.
Oh yeah.
Then I'm like, where is it? So let me just see if I can.
I know, looking for sources is the worst. Okay, I don't like this question. What are Hunter's medical qualifications? Okay, well, what are my medical qualifications? Okay.
Right.
So, yeah.
Right. I agree with that. It's very silly when people say that. It's like, no one has medical qualifications here. We are all talking about our opinion based on what we have researched ourselves. So, I'm sorry. You're going to have to give me another second here. I know this is like the awkward part of the interview where I'm like, where is it?
Do it. Take your time. I mean, I appreciate finding sources. Maybe we can agree to have a link that people could go to at the end for all of our mutual sources so that they can look at everything.
Yeah, let me just see if I can find it on Google.
Oh, someone is upset that you blocked them and now they're in my chat.
Yeah, I would be very curious to know what their hold on.
Regional Rage.
I don't know who that person is, but they're more than happy to talk if they'd like. So this is from a website called Trans Advocate, so I recognize that people might say, hey, this is biased, but it's an interview with the author, so it's not exactly like...
Sorry, is this study a single authored study?
She was the top author.
She was the first name on the page?
Yeah, Cecilia Dejny. Let's see. In 1999, when I started the Stockholm Gender Team, we were conducting diagnostic evaluations to help trans people, blah, blah, blah. Let's see. Are you aware of the way your work is being misinterpreted? Yes, it's very frustrating. I've seen professors use my work to support ridiculous claims. I've often had to respond myself by commenting on articles, speaking with journalists, and talking about this problem at conferences. The Huffington Post wrote an article about the way my research is misinterpreted. At the same time, I know of instances where ethical researchers and clinicians have used this study to expand and improve access to trans healthcare. So let's see. I put it in your chat, too, if anybody's interested.
Okay. I mean, I've seen a lot of studies on trans suicidality. We do know that trans people have the highest suicide rates of any other known subsection population.
But you said you have studies that show that there's. But you said you have studies that show that it increases. What studies do you have? Because this is the only one I'm aware of.
So if I am referring to that same study, I know that there's also studies on your side, but those N values tend to be extremely small. So I know there's a huge part of the transgender studies, a huge issue with them is there hasn't been a lot of transgender people to study until recently. So the N values have always been too far to make a decent
Well,
sample size.
even if the N values are low, what really matters is if it's statistically significant. And to my
Right.
knowledge,
It's not.
no, that's not true. If it's published, there has to be a level of statistical significance, or it will be clearly stated in the study. So I've read studies before on issues unrelated to the trans stuff that have said there's not enough statistical significance here to form a conclusion. But yeah, no.
I've seen that. It doesn't have to. I mean, not to like just label my degrees or whatever, but I'm a math major, so I've read a lot of math studies, and a lot of the times mathematicians skew figures and then don't put it in their study that they're skewing the figures. I've definitely seen that before. I've definitely seen that in medicine before, especially I was listening to
Yeah, but
your
then you
talk,
could write off any study, right?
earlier about not if it has decent N values, not if it has, like, if you look at how they took the population and they give a lot of detail on how they found the sample size, how they got the populace, how they took the numbers, if it was double blind, if it was single blind, how they run the study. And then you could determine, what a decent error value is. But you can't really know that. You can't really do all that with such a small N value. Like a lot of the studies I'm seeing, the N value of under 200. You're not going to do a proper study on that. If so,
I mean, that's not even true. You can have small sample sizes and still reach statistically significant conclusions. Of course, having a larger sample size is better. And of course, also, having a double-blind study is by far the best. I'm not disagreeing with you there, but I feel like this is more of a way to kind of dismiss any study, right? Like, what's stopping you? But what's stopping you from dismissing any study here with the same logic?
So you could put in Google, right? You could put to see like whether or not a sample size is too small. There's actually like a Google calculator that you could do that's pretty easy. Like you put in what the actual population is and then what the sample size is, and to see if there's going to be statistical significance. And I've done this with most of the transgender studies, especially the ones on your side, and there's no significance in these studies because of the sample sizes. But I understand.
But how do you know that? It sounds like you're saying because you disagree with. No, it sounds like because you disagree with the sample size that means it can't be a good step or a step in the right direction. I mean, you yourself just said. Well, wait, but you just said that. But hold on, because you just said that this is a newer thing, which you're right. Studies are newer that are coming out about this, so we can't necessarily expect double-blind, massive sample size for every single study. What it matters is we look at individual studies, and they're all suggesting one thing, which is that the suicidality goes down for people who undergo sex reassignment surgery if they're adults, or for children who undergo puberty blockers, so long as they are adequately and accurately diagnosed with gender dysphoria.
Another huge problem with these studies is, like I said earlier, the suicidality increases 7 to 10 years after. A lot of these studies are only looking 1 to 2 years after, maybe max 5 years. But the increase, when you're looking at the long-term goal, when you back out, a lot of the people who are experiencing suicidality are 10 years after transition. And another huge problem with this is transitioning hasn't been popularized until recently. So we don't have that huge population who have reached 7 to 10 years into the future past transition so that we can actually study the suicide rates.
I mean, this is 5 years later right here. I can send you this if you'd like.
That's 5. That's not 7 to 10.
Well,
which is when
but come on. Now you're setting arbitrary standards and saying unless it abides by the arbitrary standards that you've decided, that this can't be reliable. This is 5 years, which is pretty good. Gender identity 5 years after social transition from American Academy of Pediatrics.
So my 7 to 10 isn't arbitrary. 7 to 10 is I wish I had the study at my fingertips. I don't. But there is a study in which they did a long-term look, and they did find that suicidality increased 7 to 10 years after. So
Why?
then when you look at why what?
Why did the suicidality increase?
I mean, I don't here's my guesses. I don't know why exactly. Here's my guesses. There's a lot of, with the transgender surgeries, there's massive complications, especially years later. People realize that they're not actually the opposite gender that they thought that they were portraying. And I think that you come to that realization more that you're in this new body. I think that I believe that what you're going on with this question is that you're trying to say that these people maybe didn't get the support, maybe they were bullied for transitioning, maybe this, and that's what increased their suicidality. But if that were true, then it would have increased the most 1 to 2 years after the transition, as opposed to 7 to 10 years later.
What study are you talking about? Because I'm looking this up and I'm trying to find it.
Let me look. I only it's hard because I only have, I'll look it up on my phone. I only have one computer, so I can either research or talk to you. I can't like do both
I gotcha.
simultaneously.
Well, while you do that, I do
But
want to read this really quickly. I know this is only from 5 years, but this is still pretty good. And also, it has an N value of over 300. So hopefully that's satisfactory at least. And they said, we found that an average of 5 years after their initial social transition, 7.3% of youth had retransitioned at least once. At the end of this period, most youth identified as binary transgender youth, including 1.3% who retransitioned to another identity before returning to their binary transgender identity. Conclusion is these results suggest that retransitions are infrequent. More commonly, transgender youth who socially transitioned at early ages continue to identify that way. Nonetheless, understanding retransitions is crucial for clinicians and families to help make retransitions as smooth as possible for youth. So this is from the American Academy of Pediatrics. I mean, this isn't like, you know, ilovetranspeople.org.
So hold on. This is, well, first of all, the Academy of Youth of Pediatrics is ilovetranspeople.org because they have been pushing transgender surgeries for a while, and they do make a huge profit off it.
Could it be because of the research that they have is heavily suggesting that that's the best method?
I understand why you would believe that, but then I think other countries would be doing the same, and other countries are not following suit. So, and I think that there's a lot of politicalization involved in this, and America has made this a hotbed topic, especially in politics. And American Pediatrics, as you could tell by looking at who they fund and donate to, they donate to liberals only. And so when
probably because that's the side that's way more supportive of trans people, right?
Cyclical, right? So it's cyclical. They make money, they financially benefit. This is a side that they all financially benefit off this transitioning the youth. And so because it's in America, they're financially benefiting off it. Why in other countries such as Sweden, as you mentioned, they're avoiding doing this. They're not doing this in China. You think the Chinese government doesn't care about the health of their youth? Obviously, they're a communist dictatorial regime, but they want, their youth to do well, which is why on TikTok they force them to watch science videos and go to bed before 8 and do all of this
But this is basically saying that because they make money, that we can't trust them. I mean, what's to say then that the same organizations aren't falsely prescribing people with depression or falsely diagnosing people with cancer or, well, not cancer, but they make money off these things because we live under capitalism. This is a right-wing position, no?
Well, I do think that there is a lot of issues with, I'm pro-capitalist, but I do think there are issues in which we are pushing cancer medications on people where it might be better.
But you're making anti-capitalist arguments because just if they make money just if they're making money doing something doesn't mean that we cannot trust them.
I'm not saying that you can't trust anybody who, makes money or tries to make money or tries to work in a capitalist system. But what I'm saying is there is biases, and these biases are known, and you could see these biases through following the money. I'm not saying that capitalism makes everything corrupt. I understand how there is a lot of corrupt, crony capitalism does make things corrupt. That being said, I'm just saying there's clear bias here.
We don't
And
know
that's
that there's
obvious.
bias. So far, you're the one who seems biased. Because every
How
time I
do we know?
no, because every time I provide you with decent evidence that heavily supports my claim, you either say they're probably biased, or they're making money, or you can't really trust them, or they're just blindly pro-trans.
No,
These
you're
are just
saying
assertions that you're not actually demonstrating.
you mentioned the psychiatric, like the American psychiatric
The
or
American
pediatric,
pediatrics, yeah.
American pediatric. Uh, they're known for being biased. Like I don't know, like you can look at who they donate to. They don't donate to anything. Like they are known for being biased. So, and you even agree to that. So I don't
When
understand
did I agree
how
to that?
you agreed that they donated only to Democrats, and you're like, well, that's because they're the ones
Well, I
that
didn't
support.
agree that they did that. I said that there's probably a decent reason as to why, if that is the case.
Okay, but point being said, they are biased. That being said, let's look at your study again. What can you repeat the line that you said? It said after they socially transition, 5 years after they socially transition, they're not detransitioning, is what you're saying?
Yes. That's what this one
Okay.
study said.
First of all, I don't think 5 years is a long enough. I just don't think that's a long enough time frame. I think you really, if you're going to be doing a study on transgender people after transitioning, you should look at the up to the end of their life. You should keep the study going as long as possible.
Well, that's not really how studies work. Yeah.
Yeah, studies can do that, actually.
Some of
Yes,
them can,
there are.
yes. But I mean, I think, again, I feel like you're kind of adding arbitrary standards that if they don't abide by, you're able to just dismiss the. Yes, you're able to just dismiss the study because
No,
it didn't go for
okay,
10
I'll
years.
give
It was
you-
only 5, or they were a year short. I mean, this is the same kind of bullshit that like the anti-vaxxers will say, where they're like, "Oh, well, we don't have a long-term study following up, 70 to 90 years after you've taken the vaccine," because sometimes that's not necessary.
or even 10, but that's fine. And that is necessary, and that's been done in every prior
Well,
vaccine.
not
but
with the
that's fine.
vaccine, but
Anyway, so if we have, I can't, hold on, you wanted to find the study where okay, here's one. Okay, long-term study up to, hold on. Okay, no, that's the wrong website as well. It's hard these days because I know you're going to think that I'm a conspiracy theorist after I say this,
okay.
and that's okay. But when you look things up from the conservative viewpoint, it's really difficult to use Google these days. Google just is liberal leaning. So they make their algorithm to cater to liberals. And that's just, it is what it is. And so here we go.
Wait a minute. Okay, so I found the study you're talking about that came from, it was reference.heritage.org, and it sent me over to this +1 study, long-term follow-up of transsexual persons undergoing sex reassignment surgery. This is the Swedish study.
Well, it might not be the one that I'm talking about.
This is the one that said, because this is the one that said up to 15 years after the fact.
That's 15. The one that I read said 7 to 10. So
okay, well,
it's probably a different study. I'll look for it later.
Okay, well, just let it be known that I tried my best to find one. It says, wait, no, hold on. Sorry. This is 10 to 15 years after surgical reassignment. And this is the Swedish study that the author herself has come forward and said, people are misrepresenting my work.
How could you possibly say that it's the same study when I'm saying 7 to 10 and you're saying that that's
Because
15?
you haven't provided a study, and I've been looking for one, and the one that I found says 10 to 15 years and linked me to the Swedish study that's already been debunked by the author of the study.
By one of the authors. I've seen no other authors come out. And that being said,
This is what I mean with you constantly adding qualifications. You're doing it right here, right now. Every time I provide you with evidence that your position is wrong, you just say, well, it wasn't 10 years. Well, it was just one author. How many authors, how many years? It doesn't matter. If I were to provide you a study that was exactly up to your standards, you would still find some other reason to just dismiss it. Because you're accusing Google and these... Well, hold on. You're accusing Google and these other institutions of being biased. You're the only biased one here.
No, first of all, Google's known to be biased. Second of all, when your studies matter. If you're cutting it off at 5 years and people start becoming suicidal at 7 to 10 years, then your study is going to miss the most important part. I'm not adding qualifications. I'm saying your study is literally missing the most important thing to look at, the most important aspect to look at. And you're saying you're adding qualifications. Yeah, the qualification is that the study be
No, the qualification you just added was it was only one author that dismissed the study.
You're saying that this author is dismissing the study. No other author has dismissed the study. And even if you're going to dismiss the study, how are you going to dismiss the numbers?
Because the study doesn't actually demonstrate what you think it does.
What did she, like, you read what she read. She said that people are using the study incorrectly. That being said, I haven't been reading what other people wrote about the study. I'm just literally reading the study itself. I'm just looking at the numbers.
But what happens when people read the study is they're wrong about it because they don't understand
How
it.
Are you saying that I, a person who have a degree in math, don't understand how to read a table?
No, I'm saying you are wrong to use this study because it doesn't actually demonstrate what you think it does. And I'm also going to trust the author of the study over your opinion.
Okay, the study itself, she's not disagreeing with. She's disagreeing with people's interpretations of the study.
No, she has specifically disagreed with the study itself, and I can pull it back up and read more of it if you'd like.
Read it again. Read what she said again. That is not what she said. What you said, she said, is she disagrees with how people are interpreting her study. I read her study. I read the numbers. I saw the table. I saw the graph. I can come to the conclusions that the math says based on the numbers which were found using science, using regular scientific methods.
All right, let me see here. Excuse me. So the author says, people who misuse the study always omit the fact that the study clearly states that it is not an evaluation of gender dysphoria treatment. If we look at the literature, we find that several recent studies conclude that WPATH standards of care, compliant treatment, decrease gender dysphoria, and improves mental well-being. That's one blurb. Let's see. I've seen professors use my work to support ridiculous claims. Okay, of course, trans medical and psychological care is efficacious. A 2010 meta-analysis confirmed by studies thereafter show that medical gender-confirming interventions...
Repeat that. Transgender what kind of care?
Trans medical and psychological care is efficacious.
Psychological care is really helpful for these people.
Yes, it's good to go to therapy, of course.
It is good for people.
Nobody's saying otherwise.
Go get therapy. Yeah, I'm saying, so you're saying that I can't read these numbers correctly or whatever.
No, I'm saying that you're claiming that because you're a mathematician that you can, but every conclusion you've come to here has been just factually incorrect.
That's not true. You haven't shown that. You could.
I just did. I just looked up the study that you referenced, and it was the Swedish study. Right. And upon reading from the fucking author, she said the study doesn't say what you're claiming it does. You're the one who's wrong here.
Why don't you just read the study itself?
Why should I have to do that? What, do you not trust Wait, do you not trust the author of the study?
Because you are reading an author's opinion after they've probably gone through the ringer in media, being accused of being an anti-trans.
There it is, the additional qualification. So you always have the mental gymnastics to jump out of this.
I let you talk. I let you talk. You keep interrupting me. When we started this conversation, we agreed that we would let each other talk.
All right, I'm sorry. It's just you keep saying wrong things, so that's all.
Okay. Anyway, so with this study, instead of looking at her opinion years after, we don't know how her opinion has changed. Why don't we just look at the study itself and the numbers itself and the data that was collected and how the data was collected, and then see if those numbers, right, show anything. And then if we look at those numbers and we look at the suicide rates, right, 7 to 10 years later from those numbers, or 10 to 15, whatever you think it is. After those numbers, we see a drastic increase. So, and even if this study didn't say that, right, we know for a fact that transgender people have the highest rate of suicidality more than any other group. more than any other group, more than depressed people, more than uh, bipolar people, more than autistic people, more like they
Yeah,
have
but I
the
mean,
highest,
there are other
more
explanations.
than Jews in the Holocaust. Okay, they have a higher suicide rate than Jews in the Holocaust. So another issue that we're seeing, you're saying that kids after they socially transition don't detransition. However, what if they experienced gender dysphoria and instead of socially transitioning them, they just got medical treatment? They were, told they were given support in other ways instead of being affirmed in their new gender. And then they didn't even go down this path. So they weren't even on it. Now they're not included in that group who have the highest suicidality rate. We can take kids and avoid them from even joining that group to prevent them from having a high suicidality.
Well, hold on, because I mean, if we want to talk about social transition, that's simply there's nothing medical involved there. That would just be like wearing different clothes or going by a different name. But and I'm fine to move on from that. But I mean, I guess are we just gonna kind of drop the conversation about the study here? Because
I think
you keep saying, well, I read the numbers, but you're interpreting the numbers wrong.
Yeah.
Yes, and you're wrong.
How? Why don't we go over the numbers?
You can go over the numbers all you want. I'm not a mathematician like you are, so I trust the author of the study. And you only it's do you recognize what? Hold on, wait. I want you to like recognize what you're doing here is you trust the author so long as she's the author of the study that supports your claim, but then you don't trust the hold on, stop. Then you don't trust the author when she gives more clarity of the study because then it contradicts your claim.
So when someone's giving an opinion, right, I'm not going to take their opinion at face value, especially when they're being interviewed by somebody that's called trans activist or whatever the name of that website was, .org. However, I am going to use the data that they collect and then the research that they do, which is just pure numbers. It's not even her opinion. It's not even like words. It's numbers. They're totally different characters. I don't know if you know the difference.
Okay.
But so I can look at those and come to a conclusion having to hear her shitty opinion.
So her opinion is shitty, even though she's the one who made the study that you were previously citing to support your claim.
Well, she's not the only one. She's not the only one.
Well, you haven't been able to provide any other study. If you can provide some alternative evidence that we can look at, that's fine. I provided multiple different studies, all of which have completely contradicted your dumb claims.
Provided any study that looked at 20 years later and showed that people weren't.
Do you have any study that shows 20 years later?
No study exists, so how could you possibly be saying that kids aren't going to be committing suicide?
So you're again back to the arbitrarity thing. You're just like, well, we don't have any studies from 30 years later.
I am talking. How can you possibly recommend that children do this experimental thing that we don't even have studies for the results 20 years later, right? We don't even have recommend that children attempt to do this when you know that it has long-term issues. You're going to have first of all, you're never going to be able to reach orgasm. You're never going to be able to have your own children. You are going to have surgeries you're going to become a medical patient for the rest of your life. You're going to need medication, hormones for the rest of your life. You're telling me that children should attempt that? Because we don't have any long-term studies that say it increases suicide, so might as well try it.
Well, there's studies that show that there's a decrease in suicide ideation for sure.
Maybe 1 to 2 years after. But what about long-term?
Well, hold on.
What do you think about the fact that these people are permanent medical patients or will never be able to have children or will never be able to experience orgasm?
Hold on. I'm reading something. There actually are studies here. Trends in suicide, death risk in transgender people results from the Amsterdam cohort of gender dysphoria study 1972 to 2017. Median age at first visit 20 years, median follow-up time 5 years. Oh, wait, hold on. I thought this was 28 years, follow-up time 10 years. Conclusion, we observed no increase in suicide death risk over time and even a decrease in suicide death risk in trans women. However, the suicide risk in transgender people is higher than the general population and seems to occur during transitioning or every stage of transitioning. It is important to have specific attention for suicide risk in the counseling of this population. So they do actually.
So when we know that people, so if we know people have a higher suicide rate, right? Higher than the general public, why would we want to push children into a group where they will more likely
we're not pushing children in because we're not pushing kids into this group.
Well, you are. When kids are experiencing, first of all, you mentioned the social contagion of it. Don't you think the social contagion is pushing kids into it?
Well, okay, hold on. We can talk about the social contagion. I would be more than happy to. And I know you probably want to get off of this study thing because every fucking study that I'm looking at is proving you incorrect. You're so wrong, but you're like smugly refusing to just acknowledge it. Suicide death risk in trans people did not increase over time. Suicide deaths occurred during every stage of transitioning. Suicide death risk is higher in trans people than in the general population. I'll send this to you if you'd like.
Right.
Because you're saying there's an increase, and there's not an increase.
My producer just sent me 3 links to, he got one, publication.aap.org/pediatrics article, 150. Did you read that one? 5 years after social transition. And then the NCBI, NLM, NIH.
I read the one from, American Academy of Pediatrics, the 5-year one.
Okay. All right, these are the ones that actually you sent over. Okay. Why don't you talk about the social contagion? So you recognize that people in the trans community are more likely to be suicidal. So why don't you talk about the social contagion and recognize that people are socially influenced to join the trans community? And if once you join the trans community, you're more likely to be suicidal. So why would you be okay with this social contagion affecting children?
I think we should talk about that after you concede that all studies that I've sent thus far have proven your argument incorrect.
So if my argument, right, is that you're more suicidal 7 to 10 years later, and you send me a study
it's not more suicidal. There was no increase after 20 years. That was the standard that you said.
I'm talking. I feel like Kamala Harris over here. I'm talking. Thank you. Anyway, if I say that suicide increases 7 to 10 years later, and you send me a study that shows that it doesn't increase up to 5 years later, you didn't disprove anything.
You are ignoring the one I just sent you, which was up to 20 years later. And there was no increase in suicide death risk.
From NIH.
Yep, here we go. Let's hear the cope. There's going to be some way I know there's going to be some way for you to weasel out of this one too. Oh, it was from the 70s, or it was, we can't really trust the NIH. All right, I know.
I'll read the study afterwards, but
that's a good idea because it would absolutely demolish your dumb fuck points you've made thus far.
Great. So you don't think there's a social contagion?
That's not what I'm saying is a dumb fuck point. I'm saying you arbitrarily deciding that it must be up to 20 years, and then I provide you a study that goes up to 20 years that doesn't demonstrate your point.
I didn't read your and I highly doubt that. I didn't read your study yet. I don't know what the end value is. Like, as I said multiple times, I've done this for most of the studies on your side.
There were 8,000 referrals. That's the end value.
Can we please? 8,000 is the end value? That's such.
Okay, maybe. Yeah, I mean, this was based on 8,000 referrals.
Yeah, okay, that's such a BS. So these people are literally commenting in oh, me? Suicidal? No, I'm great. And these are all trans people, so trans activists. Okay, this isn't a double-blind study. This is literally people commenting. It's the weakest type of study available. It's pretty weak, asking people's opinion online. Anyway, if you think that's a study, it's that study is as good as putting up a Twitter poll.
It's just it's so funny how every single study I've sent you that disproves you. You're just coping so bad.
So let's,
You're huffing the
yeah,
cope.
you admit that it's a shitty study. You admit
No, I
that it's
don't.
just people commenting in. It's 8,000 people commenting online,
It
is
was
what you said.
out of the 8,000 referrals, and then they did follow ups with those people. So documenting people that have undergone treatment to see how they're doing 10 to 20 years later is demonstrate, or it's the exact study that you wanted.
Okay, I'll read it. I will read it. I haven't read it. Okay?
Okay.
But I do want to talk about the social contagion.
Okay, we can move on from the cope.
So you agree that there's a social contagion? You agree that transgender people have a higher rate of suicidality?
Well, trans people tend to have a higher rate of suicidality because of because of external factors. I mean, if you want to look at, say, one of the top reasons why trans people stop their transition, one of the top reasons is because of external pressure from family. Their higher risk of violence, the more difficulty in obtaining a job. So there are a lot of different variables there. As far as the social contagion, sure, but really any kind of psychological ailment has the potential to include an element of social contagion. So, for example, there's evidence that even depression can have a level of social contagion. That if you're hanging out with a group of people who are consistently depressed, you yourself are more likely to start perceiving yourself as depressed. However, that's not an argument against depressed people. That would be an argument if those people who were victims of social contagion were then going on antidepressants. That would be an argument against the medical institution in that case. So there are arguments to be made against the medical institution when it comes to trans people. No medical institution is perfect, but simply acknowledging that there is in fact a social contagion doesn't mean that trans people are bad. And it also is kind of a red herring because at the end of the day, this is an argument as to why the clinics need to be better. This isn't an argument against trans people.
Okay, I never said trans people were bad. And the issue with the social contagion is 100% with the clinics. These clinics are pushing kids to get get put on hormone blockers to get these transitions. It's really upsetting. So
where's the evidence of this?
What are you talking about? Where's the evidence?
Where's the evidence that these clinics are sitting down with kids and they're like, hey, you're trans, Timmy. I bet you're trans. Have you considered sex reassignment, Timmy? Where's the evidence of this, please?
It's happening in schools. It's happening in schools. It's been, I mean, this has been widely talked about in the news about children. I'll pull up an article about a girl who was transitioned without parents' knowledge.
Transitioned medically or socially?
Socially, without the parents' knowledge.
Okay, I'm not really that concerned about that because if it's a social transition...
How are you not concerned about that?
Because there's nothing permanent there. They're not doing surgeries.
You don't think there's psychological damage on these children, permanent psychological damage?
No, not if you've literally just put on a dress and asked to be referred to by a different name and then you realize that's not for you and then you stop doing that.
One girl attempted suicide.
Okay.
She was a girl. She was socially transitioned by her school to be a boy. She attempted suicide, okay?
Mm-hmm.
And her parents took her out of that school and, stopped talking about the gender stuff, and she became a girl again, and she's much happier. And this has happened to several kids. I understand that you think this is anecdotal, I would imagine.
Yeah, it's the N value 1. Remember how you were saying my N value of 300 or 8,000 wasn't good? You're providing me N value 1.
There's also been a lot of studies. You could look at the dysphoric.
Standards for me, but not for thee.
So there's Dysphoric, which is a YouTube documentary. They went through a bunch of different studies, and in one of the studies they talked about the change from 1990 to 2005 of the increase in young girls in middle school transitioning. So prior to the 1990s, transgender was almost exclusively male. They were able to say at the age of 2, hey, I think I'm a girl. And they were really, trying to put on dresses. They were trying to be a girl. And that was what transgenderism was considered. And then we started to see this shift in 2000s, like early 2000s, 2005. And now we're seeing this huge amount of middle school aged girls being told like anytime is a good time to transition, like anytime could be on your gender path. And so a lot of these girls are transitioning, and not only do they transition, but when they're in a group, a lot of the times the entire group of girls will transition. And you're seeing this at
Transition
schools
socially or medically?
medically. And so you're seeing this at
So
schools.
wait, hold
like,
on, wait, no, wait, stop. You're telling me that these people are deciding one day that they're going to be trans, seemingly because of a social contagion, and then they're getting surgery or puberty blockers.
Mm-hmm.
Where is the evidence of this? Because you cannot be put on puberty blockers.
So I just gave
wait,
you,
stop, please. You can't. No, stop. Because you cannot be put on puberty blockers unless you are confirmed gender dysphoric and have persistent gender dysphoria, upwards of 6 months, if not more so, if you're younger. So where the fuck is this happening?
So it is happening within 6 months. There's no, using 6 months is a short, like a long period of time.
As somebody who has suffered from depression and other psychological ailments, I can tell you that if I had persistent depression for 6 months straight, that would be very challenging. Yes.
Yes, consistent depression is very challenging. It's not a good excuse to then put yourself on permanent medical treatment that will cause you to be a permanent patient, which will prevent you from ever experiencing orgasm, prevent you from ever having children, prevent you from doing a lot of things in life.
You're just making stuff up.
What part am I making up?
You haven't provided any evidence of your claims. You're just saying it.
What part?
Where's the evidence that kids who have not been diagnosed gender dysphoric are being put on puberty blockers? Please, can I have a source for that?
They were probably diagnosed gender dysphoric, but it's very easy to be diagnosed gender dysphoric. You just say, I think I might be a boy, or I think I might be a girl.
You don't know what the fuck you're talking about. I think that you do nothing but follow like Matt Walsh and maybe Paul McHugh, because this is just complete nonsense. You're not just going to walk into because you're not going to walk into a fucking therapy office and say, I feel like a girl, and then that's it. Even the international classification. Hold on, wait, stop, because before you say anything else dumb, according to the International Classification of Diseases in 2015, they have shown that, or they have explicitly said that tomboyishness or feminine behavior in boys does not count as gender dysphoria or gender identity disorder. So again, if they're being diagnosed for simply acting feminine or being a tomboy or wanting to be a boy one day, then again, this is a problem with the clinics not following the guidelines. This is not a problem with trans people.
That's probably what's happening. I do think the clinics are not following any guidelines. I think that they are transitioning tomboys. I think they are transitioning slightly effeminate men. They are transitioning kids way too early, and they are a lot of the times doing it without parental consent.
So you don't trust the quote-unquote opinion of the author of the study that you earlier tried to cite to support your claim, but we should just believe your opinion? Random mathematician here somehow knows better than medical institutions? In
what sense? Like, what are you referring to here?
You're like, I do think they're transitioning them too soon. Okay. Cool.
I mean,
I'm glad you think that. Can I have some source? Can I have an evidence?
These children haven't even experienced sex yet. So you think a child who's never experienced sex has the cognitive ability to understand that they're giving up children, they're giving up sexual pleasure, they're giving up a lot.
Do you think that kids can suffer from like ADHD?
Permanent medical. I don't think when you suffer from ADHD, they take off a piece of your leg and attach it to your vagina to make it a fake phallus.
Right, because last I checked, that's not happening to children. But
that is happening. It is happening.
Can you give me a source, or is it I made it the fuck up again?
Yeah. No, you could look at the Boston hospital. You could look at the Vanderbilt hospital. They were talking about medically transitioning kids as young as 14 years old on their website. They recently took it down.
What is medical transition? Because if you're talking about puberty blockers, then that's not the same.
No, they're talking about top surgeries.
Okay, so we can. Okay, fine. We can move on to that. You
think children should get hysterectomies?
No.
Okay.
I'm wondering if you think. Do you think that it's possible that kids can suffer from ADHD, depression, anxiety, like any of these psychological disorders?
Yes, I just don't I think
Okay.
when they
So if they
suffer that,
can, then do you
psychological help, and when we give kids help for transitioning, we're giving them like physical treatment for a psychological disease.
so
So
you
when they
believe
suffer,
wait, stop. So you agree then that it's possible for children to suffer from ADHD, depression, anxiety. Why is it then unfathomable that a child could not or could suffer from gender dysphoria as well?
they can. I just don't think the solution is medical transitioning. I think the solution is psychological help, just like it would be if they had ADHD or depression or any other psychological disease. I don't
Well, they
think that
go
you
on
should then
medical treatment for
chop
that.
a part of their leg. I don't think no, they don't get part of their leg ripped off. They don't have their penis cut off. They don't have all of these things
If you
if
can
they're
give me any
depressed.
evidence
Okay.
that anyone has had their penis cut off before the age of 18, I would be very curious to see it.
Sure.
Okay. I think that you're not understanding that they get psychological help. Like that's what happens when you go to therapy, when you're diagnosed.
But they're being told, like, if I were to go to a gender clinic, first of all, another issue I have is I wonder how many of these kids, when they go to the gender clinic, are told, no, you're just a tomboy. Actually, you're not transgender. I bet you when somebody goes there and they say, I don't know, I think I might be a boy, they're very much affirmed as a boy, right? And
Okay, well, I
so
mean, I don't care what you think, and I don't care what you bet because so far you've been wrong about everything else. So I mean, no, I wouldn't trust your bet.
you haven't shown anything. I know that you think that you do that because you're not very good with numbers or whatever, but maybe that's why you think the way
Says the
you do.
person
But
that
you haven't.
misinterpreted multiple studies. But okay,
I mean, you haven't even read the study. You only read an opinion after somebody
it
was,
wasn't an opinion. It was the
bullied.
author of the study herself explaining why
.com.
the study was being
Contransactions.com.
misrepresented by dipshits like you.
Yeah, but you didn't even read the study.
Yeah, I
You didn't
have.
even
I've read
study.
the study before.
What actually, Hunter? What? Just out of curiosity, what is your like educational background?
I thought that you already said that that was a dumb argument to make to your own chat.
I think it's a dumb argument to say that you can't have an opinion on a medical issue just because you're not a medical, doctor. But I am curious what your educational background is now that I'm talking to you. I am curious.
I'm more than happy to go into that in a minute. I just think that I would want to know. So you say psychological help. What do you think should happen then? If there's somebody who say is diagnosed gender dysphoric, okay, what should happen?
I think that they should, be told that it's okay to be. Well, first of all, if it's male, it's different. I think if they were experiencing gender dysphoria at the age of 2, they were talking about, being a girl as soon as that they could talk. I think that's a vastly different situation. I think that's genuine.
That's like
somebody
transsexualism almost because
yeah.
So for example, there is evidence too that shows that say if you're biological male, right, but you identify as a woman, your estrogen pathways, or excuse me, sorry, your estrogen receptors react differently. They're functioning differently than how, say, a cis man would have his estrogen receptors in his brain function. So I agree with you. There's quite a possibility, yes, that there are
But that's
people.
for a very small percentage. But I think however, if there were a boy, right, and he were in middle school and he never showed any signs of saying that he was a girl, and then he, was maybe effeminate or maybe he was gay or whatever, and he became socially peer pressured into thinking that he was a girl, yeah, I would feel like it would be really negative to put him on puberty blockers, because one, it's bad for his health. As you mentioned, it gives you osteoporosis. 2, I think if he then became a woman, it would require him to take off his penis, which would prevent him from ever reaching orgasm again, prevent him from ever having children. He would have to receive top surgery. And then also another issue is a lot of these people don't end up fronting as well as they wish that they could. So that causes social issues, of course. And
Well, yeah, but
I
I mean, yeah, of course, if you're a victim of peer pressure, and you're not actually gender dysphoric, I agree that would be a problem. But like, I'm saying hypothetically, let's say let's say you have a boy, okay, or a biological male, and he's getting close to puberty, which is understandable that you might start experiencing some gender dysphoria around that time. And then he's had persistent gender dysphoria and discomfort with his gender identity, with his body as well. And he's now diagnosed gender dysphoric. He's gone through the best possible evaluation. He's met with therapists and his primary care physician. They've all said, you have gender dysphoria. Here is your diagnosis. So hypothetically, what should happen then?
Yeah, I still think that he shouldn't go through any surgery, because I think he has an 80% chance of I'm looking for these studies. I swear to God, it's so much harder to find studies. I'll send you all these studies to your email, and maybe I'll post it on the link below afterwards, and maybe we could do like a follow-up. I wish I had the studies prepared, but we, planned this with 2 minutes to spare, and it's super last minute, so I don't have the studies ready. But, what I've read in the past is about 80% of these people post puberty, the ones that decided not to transition, are relieved that they didn't transition. And
what happened? I'm sorry, what did you say? The 80% what?
80% of the people who don't socially transition, who experience some sort of gender dysphoria and don't socially transition, are post puberty, are happy that they didn't transition and want to remain in their biological sex.
Okay, cool. Yeah, I don't know. I would want to see that.
So if that's true, then that person who is experiencing gender dysphoria pre-puberty, if you just don't do anything and you give them support and love and tell them that they're, experiencing something really tough and that they're loved anyway, and that you'll help them mentally and support them through suicidality, post-puberty, a lot of the time they won't experience that suicidality anymore, and they won't be gender dysphoric anymore. So however, if you had transitioned them, now they're transgender. Now they're part of the population with the highest suicide rates of any other group in the country or in the world.
Well, hold on. Okay, before we go that route, so what should happen instead then? Like, what do you do with that person who's saying, like, I am super uncomfortable with my body, my gender identity, my self-perception doesn't align with the physicality here, I'm distressed, I'm suicidal, I'm depressed. What should be done then?
Yeah, you should address the suicidality. You should address the depression. You should address, you should even address the gender dysphoria. You should, the same way that you would address depression and suicidality for any other person, whether or not they're experiencing gender dysphoria. And you can radically accept, like, wow, I can understand how it must feel to feel like you're in the wrong body. A lot of people feel this way. It's not just you. We support you and love you, and we want to help you through this, but you're not in the wrong body, and your body is perfect the way it is. God made you who you are. If you're not religious, you don't have to say the God part, but
I hope not, because that would be really dumb. Because that same exact argument, God made you the way that you are, it could be used against people who want to go on antidepressants, because, well, God made your brain the way it is. You just got to suck it up and deal with it. So,
well, first of all, antidepressants even are that. As of recently, I wouldn't have said this like a month ago, but new studies have come out that show that antidepressants aren't even that helpful.
Didn't the new study say that serotonin wasn't the sole reason or the sole contributor to depression or lack thereof? I didn't think it said they're not effective.
Yes, the study said that not only did the study show that SSRIs are not very effective, but they can also increase suicidality, and it might be temporarily effective, but not effective in the long term, is what the study did show.
Okay, well, okay. But I mean, yeah, we don't need to get sidetracked, because I did find this as well. I can send this to you. This comes from the NIH as well. Pubertal suppression for transgender youth and risk of suicidal ideation. And this is using a cross-sectional survey of 20,619 transgender adults, aged 18 to 36 years. And let's see the conclusion. This is the first study in which associations between access to pubertal suppression and suicidality are examined. There is a significant inverse association between treatment with pubertal suppression during adolescence and lifetime suicidal ideation among transgender adults who ever wanted this treatment. These results align with past literature suggesting that pubertal suppression for transgender adolescents who want this treatment is associated with favorable mental health outcomes.
I'm going to have to read the study because, I mean, I've seen studies that say the exact opposite. I'm going to have to read that study. You're saying it's 2,000 people and then
20,000. It was a cross-sectional survey of 20,000 people.
How long was the study for?
We examined self-reported history, pubertal suppression.
Self-reported history.
Yeah, you're going to have to use self-reports when it comes to, like, puberty blockers and how it affected their mental health. I mean, that's how we would evaluate any kind of psychological thing, really. Using multivariable logistic regression, we examined the association between access. All right, let's see. Trying to see how long
I'm going
it
to
went.
read the study after, but this isn't even to do with the social contagion. It just seems like you're trying to shift topics.
No, I'm not.
Like,
I'm
you
trying to
agree
demonstrate.
that
Wait,
it was-
no. I'm not trying to shift topics. I'm trying to say that, again, the available research we have heavily suggests that puberty blockers are beneficial for reducing suicidal ideation if we're talking about youth who are suffering from gender dysphoria. And you're saying you're against this. So you need to offer an alternative that isn't just, well, just talk to them, bro.
Your study is 18 to 36. You just said that. How is that transgender youth?
Because they're adults aged 18 to 36 years examine self-reported history.
You are not addressing my point. So if these are transgender people, right, then you're not including the 80% of people who didn't go through the transgender, which is the population that I'm referring to.
I don't know. Okay.
Like this study,
I don't know what you're even saying right now. I mean, we're talking about adults who went through this treatment when they were still youth. And we saw that there was a significant decrease in suicidal ideation.
What? According to them. Okay. Also,
yes, according... Wait, stop. No, please. Yes, according to them. How else are you going to... Come on, Lauren. How else are you going to evaluate this?
Look at the rates of suicide. And we know that the rates of suicide are highest among the transgender people than any other subgroup of the population. Now,
yes, and there are explanations that are external.
I'm talking. Now, if you want to look at a group of people who are experiencing gender dysphoria in their youth, and look at the percentages of those who go through transitioning and those who don't go through transitioning, you would see those who didn't go through transitioning have lower rates of suicide because they're not part of the group that is transitioned, the transgender group, which has the highest rates.
Probably because they're not suffering from external discrimination, yeah.
So no matter what the reason is, they have lower suicidality rates, right? So why?
Because they're not suffering from discrimination, which is a problem in and of itself. People should be able to be who they want to be, and they should be able to identify the way in which they want to identify without needing to worry about suffering severe discrimination.
Okay, you're saying that these people are, because they're suffering from social discrimination, that's why they're committing suicide, but you're ignoring the fact that but then you're saying the people who aren't transitioning, who aren't getting the medication that you're saying prevents suicide, they have lower suicidality rates. So what you're saying makes no sense. Because I'm saying these people...
No, you're talking about people who have not transitioned. You're comparing trans people to people who have not transitioned. We already acknowledge that there is a higher rate of suicidality amongst those who have transitioned.
I hate raising my voice. Don't interrupt me.
Can you stop being wrong and then I can stop interrupting?
I am talking about people who experience gender dysphoria and chose not to transition. They have lower suicidality rates than people who have chosen to transition. Why then would you encourage people to transition if they experience higher suicidality rates?
Because they have higher suicidality rates if they don't get the treatment needed.
This is literally not true.
Can you send me a source, please? Because right now you're just making shit up.
I am going to send you... I don't have all of the sources because...
You don't have any sources. You're just making up shit.
I'm not.
You're comparing people who have gone through the actual transition to the general population.
I'm not. I'm talking about... No, I'm not. I am talking about people who experience gender dysphoria in their youth. right, said that they were gender dysphoric, chose not to go on puberty blockers later in life, they are happier than those who chose to go on puberty blockers and get transitioned.
Yes, and I'm explaining that one of the reasons why they would be happier is because because they are in with the general population. And so they are not subject to the same degree of discrimination that trans people are otherwise subject to.
It doesn't matter. As long as people are committing suicide at a higher rate, I want to prevent people from committing suicide at a higher rate. I want to prevent people from experiencing really negative medical issues. And the way that I would do that is preventing youth from going through something in which they will be joining a group with higher suicidality rates.
So don't you think it's important as to look at to why they have a higher suicide rate?
I don't think it. If they have higher suicidality rates, I understand that you think it's because of social issues, but I mean, Thailand also has high suicidality rate among their transgender, and they're considered like special people in Thailand. They haven't been discriminated against the same way that they have in America.
Okay, so let's think about this from another perspective, because using your logic, I could say, I don't think it really matters. We should just stop encouraging people to be white. No more white men. Get rid of them, because white men have a higher suicide rate. And I don't want to contribute to that group that has a higher than average suicide rate.
That's insane, because you could choose to be medically transitioned. You can't choose to be white or male.
You can maybe choose to get transitioned, but you don't choose to be trans.
You choose to go through the transitioning process. You don't choose to experience gender dysphoria. I'll give you that. But I'm saying gender dysphoria is not usually permanent. I'm saying most youth get past gender dysphoria if not treated with the transition stuff.
So why shouldn't this argument be made against any other group with higher suicide rate? So maybe, you know what? I think that people should stop. Hold on, wait. I think that people should stop volunteering to support this country. I think that all veterans are bad because they have higher suicide rates.
I'm a veteran.
Well, you have a higher than average suicide rate. That's very unfortunate.
First of all, I never called transgender people bad, right?
I didn't say you did.
That being said, you keep saying that.
I'm making the same argument that you're making.
You're making an analogy. You're like, well, that doesn't make veterans bad just because, and I'm saying, well, I'm not calling transgender people bad. I'm just saying I don't want them to join a group that will cause them, and the group that I'm referring to is those who medically transition. I don't want them to join that group and then be more likely to commit suicide.
So do you not want people to join being a veteran, the veteran group?
Well, veterans, even though they do experience higher suicidality, I personally may, out of selfishness, not want certain members of my family to become veterans because I wouldn't want them to experience PTSD and high suicidality. That being said, I understand why people do join, like I briefly did, because it's important to support your country and to defend its rights.
So you're okay with people joining the group where they're likely to have a higher suicide rate? Like broadly and generally speaking?
Also, one is children, right? And one is adults. We're talking about children. And we were also talking about the mass psychosis of the cultural influence right now of children.
No, because your argument was that you don't want people to transition because trans people tend to have a higher suicide rate. First and foremost, you're ignoring the fact that the suicide ideation goes down if you have gender dysphoria and then undergo treatment. You're also ignoring any of the external factors that are contributing to the suicidality, which repeatedly has been demonstrated. Hold on, wait. Which has repeatedly been demonstrated to be an external social factor. And so I'm saying, according to your logic, why are you not applying this equally to veterans? Just don't deploy.
That's so silly because the difference.
It is silly. Yes, I agree. Your argument is very silly.
when you're being a veteran, you're sacrificing something in yourself, and you're sacrificing on behalf of the better good, on greater good. Whereas if you're becoming a transgender person, you're sacrificing your ability to have sex and children in the future and not be a permanent medical patient, and you're not even helping the greater good in any sense. You're not even helping yourself in that matter.
Lowering
So,
your
no,
likelihood of committing suicide is helping the greater good.
you're like
But
increasing your
furthermore, no, they're not increasing. But furthermore, why is this that who cares? So you're sacrificing this for the greater good? Okay, well maybe the trans kid who had gender dysphoria, he underwent the transition, is sacrificing for the greater good to show that it is in fact a possibility that this can benefit people. Like we could just make this argument the same.
That's not
So why are you okay with people being veterans?
other people to sacrifice their bodies is not for the greater good. And also preventing children from having future children is also not for the greater good, whereas veterans going and serving their country is for the greater good.
So if it's for the greater good, you're okay with more suicide?
I think that sometimes, right, people do things that create PTSD in them, or like do things for the benefit of others, which might detrimentally harm themselves. I don't think that people should detrimentally harm themselves. However, I think it's admirable when people do it in the name of others. Transitioning is not admirable in the name of others. It's supposed to be a medical experience that youth are going through in order to help them feel better from gender dysphoria. However, we haven't had any long-term studies showing that it does any good for them. We have a lot of knowledge. We already know about all the medical complications. You know that they have to go through multiple surgeries. Like once you get the fake penis, you have to go through multiple reconstructions. It falls apart. You have to have a colostomy bag for a while. You have to have, these are really.
This is, at this point, we're talking about people undergoing the full transsexual treatment type thing, which would happen more in adulthood. And again, there is a plethora of evidence to show that this does, in fact, benefit trans people overall and including long term. So there's that fact. Second of all, these are qualifications that don't change anything.
Even the permanent medical issues,
they're better off afterwards. Yes.
You think that it's better off?
I don't think this. The professionals do.
To go from a healthy physical person who experiences gender dysphoria to somebody who has to have a colostomy bag and has osteoporosis and has will never be able to experience orgasm and is no longer to have children and has their breast removed. You think that's a healthier individual?
If they are an adult undergoing the full sex reassignment surgery, then yes, it has been demonstrated.
What do you think about Vanderbilt talking about giving 16-year-old girls hysterectomies?
I would probably be against that because that contradicts the WPATH guidelines in many ways. Again, though, this is kind of a red herring. So I don't know why going to war, because it helps other people, but also raises your risk of committing suicide, is okay. But yet undergoing a medical treatment, which has been demonstrated to lower your likelihood of committing suicide, isn't okay. Why are you supportive of veterans again? Because it's for the greater good? This just seems very, very arbitrary again.
This is a silly argument that you're making. I think it's silly at this point.
If you think it's silly, then you also have to concede that your argument as far as trans people committing suicide is also silly.
No, because I think that kids are really being socially pressured into joining this group, and then they are joining a group with higher suicidality rate, and I think that they are committing suicide at a higher rates. And you have to look at the youth suicide numbers from 2020.
Do you know how many kids are pressured to join the military? Do you know how many people will come to recruit at schools? Are you against that?
Actually, yeah, I am against that.
Okay, cool. Well, at least there's some consistency. I can appreciate that.
I don't like recruiters at all, military recruiters. Anyone in the military doesn't like military recruiters.
Okay. Well, I'll send you this final study here, and then we can probably part ways.
I really appreciate your time, and because this was so last second, I didn't have any of my studies pulled up. if you would want to, maybe like 6 months from now, because this was just so recent, and I'm sure you're busy and you're going to have John Doyle and you're going to have so many really interesting guests. I'd love to do this again in the future.
Sure. Yeah, absolutely. I'm trying to see if I can find this last one here. Let's see. Hold on. Oh boy, here we go. Here we are. Okay, I'll send this one to you too.
I really appreciate your time. Thank you so much, Hunter.
I'll read this one too before we go. So this is a systematic literature review of all peer-reviewed articles published in English between 1991 and June 2017. 55 different studies were assessed. This search found a robust international consensus in the peer-reviewed literature that gender transition, including medical treatments such as hormone therapy and surgeries, improves the overall well-being of transgender individuals. The literature also indicates that greater availability of medical and social support for gender transition contributes to better quality of life for those who identify as transgender.
Yeah, I really need to read these studies, and I'm going to look for my studies before we talk again, and I'll have them printed out so that I can have them at the ready.
All right. Well, I do feel like this conversation may have increased my likelihood to commit suicide, but yeah.
Really? Why?
Because it was painful that you didn't provide any arguments or send any sources, or you wrote off the person as an opinion, even though you were citing their study a minute ago. So it's fine.
You were reading their opinion. They have a study. You're more than welcome to look at the numbers in the study if you wanted to, instead of referring to opinion pieces.
I mean, I can maybe, but I mean, then I'd end up kind of like you, where I have the wrong opinion because I'm too arrogant to accept when I'm wrong. But yeah.
Okay, please don't kill yourself. I know that you're not very good at math, so like maybe that's
I do. You're definitely making me suicidal and making me want to kill myself. But either way, yeah. Thanks again.
2 + 2 is 4. Keep it up. Bye.
Wow. Well, I thought that I was going into a very nice little chit chat